Why does the glucometer sometimes give false readings? You measure your blood sugar, see high numbers, get scared, and then 5 minutes later the reading is different. In reality, very often the problem isn't with the glucometer at all. Today, we'll go over the most common mistakes that can lead you to get incorrect results and make wrong decisions because of them. My name's Dr. Getz, and I'm an endocrinologist. Let's get started. But before we talk about why the glucometer might be wrong, I want to mention the most common problem. A lot of people with diabetes don't measure their blood sugar at all. Recently, under one of my videos, I saw a comment, "The main thing is not to pick up the glucometer, and then your blood sugar will always be good." Well, that's some ironclad logic. If you close your eyes, then it seems like there's no problem. But diabetes doesn't care about that at all. As long as you don't monitor your blood sugar, the disease keeps damaging your blood vessels slowly, quietly, day after day. That's exactly why we end up with heart attacks, strokes, vision loss, kidney problems, leg pain, and even amputations. I worked for several years in an emergency hospital and saw a huge number of patients who could have avoided these complications if they had just regularly monitored their blood sugar. That's why the first rule is very simple. Don't be afraid of the numbers, be afraid of not knowing those numbers. Now, the second important point, a lot of people use a glucometer completely the wrong way. You go to visit someone, see a glucometer, and decide to check your blood sugar just out of curiosity. You see a high reading and immediately jump to the conclusion, I must have diabetes. No, a glucometer is not meant for making a diagnosis. It has an allowable margin of error. It measures capillary blood from your finger, not venous blood, which is what's used for diagnosis. That's exactly why sometimes two different glucometers, even if you use the same drop of blood, will show slightly different results. And that's absolutely normal. It doesn't mean that one of the devices is broken. It just means that's how the measurement technology works. That's why a diagnosis is always made only after laboratory testing. And a home glucometer is needed for something completely different. It helps you understand how your blood sugar behaves after eating, physical activity, taking medication, or at night. So it's a tool for monitoring, not for diagnosis. Remember that. Now let's move on to the reasons why a glucometer can actually show incorrect results. And the first reason is very simple, dirty hands. Yes, it sounds funny, but imagine this situation. You just ate an apple, a tangerine, a piece of candy, or some chocolate. Microscopic sugar particles remain on your skin. Then you prick your finger, the drop of blood mixes with what's left on your skin, and the device shows a higher sugar level than you actually have. So the first rule is, before every measurement, wash your hands with warm water and regular soap, dry them well, and only then check your blood sugar. It takes less than a minute, but it saves you from a huge number of false results. The second reason, which not many people know about, is temperature. If you just came in from outside and immediately decided to check your blood sugar, don't be surprised if you see some strange numbers. In the cold, your blood vessels constrict, blood flow in your fingers gets worse, and because of this, the composition of blood in the capillaries changes a bit, so the device might show a result with a bigger margin of error. So after being out in the cold, don't grab the lancet right away. Sit at home for at least 5 minutes, warm up your hands, and only then check your blood sugar. This simple rule makes the readings much more accurate. There's another situation I've seen regularly. A patient is getting an intravenous glucose track. Then the nurse draws blood from the same arm where the IV is, and suddenly the blood sugar turns out to be very high. Everyone starts to worry, they want to change the treatment, they want to call in an endocrinologist. But the problem isn't diabetes at all, it's just that the blood was drawn from the wrong arm. So if you ever get a glucose IV, never check your blood sugar on that arm. It's better to use the other one. It might seem like a small thing, but it's exactly these little details that can completely change your test results. Now let's figure out why sometimes it's not the person's fault, but the device itself. A lot of people buy a glucometer once and use it for 10 years, treating it like a hammer. As long as it doesn't fall apart, they think it still works. But a glucometer is still a measuring device. Any piece of equipment becomes less accurate over time. So if your device is already several years old, don't be lazy. Check it at least once a year. It's very easy to do. When you go to the lab for a blood test, take your glucometer with you and compare the readings, or ask your doctor to help check its accuracy. Sometimes it turns out that the device is already showing blood sugar with a noticeable error, and a person ends up adjusting their treatment for months based on incorrect numbers. So if your glucometer is very old, it's better to replace it, especially since modern models have become much more convenient. There are devices that automatically save all results to your phone. There are test strips that draw in blood on their own, even if you didn't apply them perfectly. There are features that let you collect more blood if the first drop wasn't enough. Everything has become much more convenient than it was 10 years ago. People constantly ask me, "Doctor, which glucometer is the best?" And honestly, I don't have an answer to that question. It's kind of like asking which car is the best. It all depends on your needs. But there's one tip that can really help you save money. Don't look at the price of the glucometer itself, but at the price of the test strips. Very often, the device itself is inexpensive, but then it turns out the strips are really expensive. And it's the strips that you'll be buying all the time. If your budget allows, you can even use a continuous glucose monitoring system. It's a small sensor that attaches to your skin and measures your blood sugar around the clock. You don't have to prick your finger every time. It's very convenient, especially if your blood sugar changes often. Yes, of course, it's not cheap, but in terms of diabetes management, it's one of the most comfortable options. And now the timeless algorithm for measuring blood sugar. If you follow just a few simple rules, the chances of making a mistake will be minimal. So first, wash your hands with warm water and soap and dry them thoroughly. Second, if your hands are cold, warm up for at least 5 minutes first. Third, there's no need to treat your finger with alcohol before measuring. Regular hand washing is more than enough. If you did use an antiseptic, wait until your skin is completely dry. Fourth, prick your finger not in the center but on the side. There are far fewer nerve endings there, so the procedure will be much less painful. Fifth, wait for a proper drop of blood. Don't squeeze your finger too hard to get the drop. Otherwise, tissue fluid will mix with the blood, which can also slightly affect the result. And these simple rules significantly improve the accuracy of the measurement. I also want to say a few words about hypoglycemia. If you experience trembling, weakness, cold sweat, or intense hunger, and you suspect your blood sugar has dropped, first address the hypoglycemia. Drink some sweet juice, regular cola, or eat a few pieces of sugar. And only after you start feeling better, calmly wash your hands and measure your blood sugar again. Because in this situation, your health is much more important than the measurement itself. So the main thing you need to remember, the glucometer does not treat diabetes. It only shows what's happening with your body, but what you do next with those numbers is up to you. Proper nutrition, weight loss, physical activity, well-chosen medications, and regular blood sugar monitoring really do help significantly reduce the risk of complications. That's why you shouldn't measure your blood sugar just for the sake of it, but to catch any problems in time and be able to fix them. Thank you for watching the video until the end. If you found it helpful, be sure to like the video and subscribe to the channel. Thank you for watching and stay healthy.